Hello, my name is Jean Lamantia, and I'm one of the co-authors of this book, The Complete Lymphedema Management and Nutrition Guide. And I wrote this book along with Anne DeMena, who's a physiotherapist and certified lymphedema therapist, and I'm a registered dietitian. So if you have lymphedema, Anne and I want to help you to care for your lymphedema on your own. So we have all kinds of strategies here, all kinds of self-care that you can do. And I want to focus on the nutrition strategies that can help. So I'll tell you what each of my chapters covers and just give you a few highlights. So the first one, I talk about body weight. So we know that weight loss can help reduce lymphedema, and if you've had lymph nodes damaged or removed, that being overweight is a risk factor for the development of lymphedema. So weight loss strategies would be helpful, or certainly maintaining your weight and preventing further weight gain if you're sort of trending up. So you want to try and maintain that weight even if you can't lose. That would be helpful. But I do talk about different strategies to help with weight loss, even simple things that you can implement to help you with that. The second thing I want to talk about are lymphatics and the digestion of fat. So there are different lengths of fatty acid chains. So when you have an oil in your diet, the fatty acids that make up that oil can be short chain, medium chain, or long chain. And after those oils enter the small intestine, the short and the medium chain fatty acids are absorbed there in the upper part of the small intestines. The long chain fatty acids are not soluble enough to be absorbed there. So they continue through the intestines and they're put into something called a chylomicron, which you can think of as a fat transporter spear. So those long chain fats go into the chylomicron, which go through the lining of the small intestine into the lymphatics. And they travel all the way up the central lymphatic trunks into the left subclavian vein, and they enter the bloodstream up in your neck. So as they're traveling up through the central lymphatics, there's more congestion there. So you may find that you can reduce your lymphedema by changing the types of oils that you use, or reducing the amount of oil and fat in your diet. So most vegetable oils are 100% long chain fatty acids, so reducing those added oils in your diet can help. And there's been a couple of research studies, I talk all about the research in here, that show that's beneficial. The third nutrition strategy is reducing inflammation. Lymphedema is an inflammatory condition, and you really get into this vicious cycle because what happens is the lymphatics are not working properly, and so the fat leaks out of the lymphatics. That fat creates fatty deposits. Those fatty deposits, visceral fat is an endocrine organ, means it secretes hormones and messengers or cytokines. And one of the messages that this fat deposits put out is to say, create more inflammation. And so when there's inflammation in the body, then more lymphatics are actually created. There's a process called lymphangiogenesis. So angio means vessel, blood vessel or lymphatic vessel, and genesis means the creation of new, which sounds like a good thing because you're creating new lymphatic vessels, but unfortunately the types of vessels that are created in an environment of inflammation are not formed properly. So then you get lymphatics that don't function, and then you get leakage, more fat deposits. So you see there's this vicious cycle that just keeps going around. So the way out of that is to reduce the inflammation in your body. Well, how do you do that? Well, research has shown that your diet can affect the amount of inflammation and the amount of inflammatory messengers in your body. So an anti-inflammatory diet can be helpful. The next strategy is to have the right amounts of fluid, protein, and sodium. So if I, as a registered dietitian, if I have someone who comes to me and has swelling, the standard of care for swelling is to say, oh, you need a fluid restriction. And that's because most swelling is thought to be, from for example, congestive heart failure, or kidneys that don't work properly, or a liver that's not working properly, or heart that's not working properly. And in that case, you want to reduce the burden on that organ, so you restrict the fluid. However, that's not the standard of care for lymphedema. If your swelling is lymphedema, you do not restrict fluid. In fact, you encourage more fluid. So that's important to know the distinction. Also, many people, because they know that lymphatic fluid is high protein, they mistakenly think that, well, because I have all this protein in my lymphatic fluid, if I restrict the protein in my diet, that can help. Don't do that. Restricting protein doesn't help. So you want to maintain your protein needs in your diet. So somewhere around, on average, probably 1 gram of protein per kilogram body weight. But the third thing that you want to pay attention to is your salt. And so in this case, treating lymphedema is very similar to treating other fluid conditions, in which you would want to have a sodium or a salt restricted diet. Okay, so reduce the amount of sodium. Another supplement I have another chapter is a whole section on supplements. So I review the research on all the different supplements. And so that's all contained in here. So if you want more details on the diet for lymphedema, you can check out the book, which is available at all places where books are sold, as well as my website, jeanlamatia.com. If you want a signed copy, let me know when you order the book, and I'd be happy to sign the book for you when I send it out. And I think, implementing the nutrition strategies as well as the physical therapies, so the complete decongestive therapy, can really, really help you manage your lymphedema. So I hope you get a copy of this book and start implementing some of these strategies. Bye for now.